My name's Amanda. I'm 25 years old. I was born and raised here in San Antonio. I found out that I had breast cancer on February 14th of 2013 of this year. I noticed I had a nipple discharge, and that's what alerted me to go to my family practice office, where they initially said that my nipple was just dry, that it wasn't anything. After I finally had an MRI and an ultrasound done, they did it in a mammogram. They found out that I did have invasive ductal carcinoma, stage 1, in my left breast, and that I would need to have surgery to remove it. So that's when I started looking at my options in terms of a mastectomy, a lumpectomy, a double mastectomy, and what I should do from there. They didn't think I would need chemo at this point in time because of the size of the tumor. However, I needed to look into that though, because of my age, being 25 years old and having a breast cancer with no family history of cancer. So I decided to go with the double mastectomy, being my age, and I wanted to be very aggressive with my approach in getting rid of this cancer. So I met with my surgical oncologist, who then told me about PRMA, and we also had a family friend that had breast cancer who came to PRMA, and then that's when I went to the website and kind of looked at the different doctors and everything, and my surgical oncologist recommended Dr. Crisopolo, and after I decided to go with Dr. Crisopolo and PRMA, I sat down with him, and he made me feel very comfortable about the whole reconstruction process. We decided to go with the tissue expander option because I didn't have enough stomach fat or back fat or anywhere else to use for my reconstruction. So I had my double mastectomy in March, and Dr. Crisopolo placed the tissue expanders in, and then I will have to get my implants in October of this year. But Dr. C definitely made everything much more relaxed. It's definitely one of the appointments I enjoy coming to. It's been a great experience working with him. He definitely adds light to the situation and makes me feel that everything will be okay, and that I will have a great cosmetic outcome once everything's finally said and done. So I can't wait to see that everything's healed properly, and I'm just waiting now to get my implants. But after I had my double mastectomy, they found that the cancer had went to an intramammary lymph node. Not any lymph nodes under my arms were affected, any auxiliary lymph nodes, none of those were affected. So being my age and that the cancer went to an intramammary lymph node, they did further testing and found out I was HER2 positive. So that then prompted me to do 6 rounds of chemotherapy. And you're probably looking at me like, how do I still have my hair? So I looked at a cold therapy option. We had a family friend that had breast cancer and did the penguin cold caps, where during chemo they'd put a cold cap on my head and pretty much freeze my scalp to prevent the chemo from getting to my hair follicles and preventing it from falling out. So during chemo, we would put the cold caps on and change them out every 20 minutes to ensure that the cap stayed at a negative 30 degrees Celsius. And it was cold and it hurt, but I still have all my hair, so I'm very thankful for that. I wish more women knew about the option to save their hair during chemo. I know it may not be for everybody, but it is out there, and if they're interested in doing it, I'd be happy to talk with anybody about it. But I definitely am thankful that I got to save my hair during chemo, because it made things a lot easier in terms of looking at myself in the mirror every morning. And even though some days I didn't feel sick, so I didn't have to look sick, I still had all my hair and could pretend everything was normal. But I did finish on August 29th, and I will get my implants in on October 14th of this year. And then after that, I will do nipple reconstruction. I'll have my left nipple reconstructed and tattooed on then. They were able to save my right nipple because the cancer wasn't in that breast. So Dr. Christopoulos will do those surgeries as well, and then I should be done from there.